Statistically, one child out of 100 births has a heart or chest condition. Smoking, excessive drinking, long exposure to X-ray, and poor eating habits by pregnant women are some of the causes of heart and chest conditions in children. The taking of drugs without prescription and the failure of some expectant mothers to attend antenatal care are the other causes. For most patients suffering the disease, cost is a huge barrier. Here is consultant at the National Cardiothoracic Center, Dr. Koh Ensua Mensah.
One of the pains that we have had is to see a child with a hole in heart condition who can be saved through relatively simple surgery, and there are no resources to be able to do that. It's very painful. Sometimes when you mention the amount, the parents break out in tears because some of them cannot actually imagine what the equivalent of $6,000 look like because they work with such a very small capital. And to have the opportunity to be able to do free surgeries for 25 children every year, that's about a third of our capacity now. It's extremely significant.
But there is hope now, at least for the next 10 years, because patients without means to undergo surgery can apply for support from the Shen Yuan and Shen Yuan Foundation. Named after 17-year-old Shen Yuan, himself a hole in heart survivor, is a son of Chinese investor Shen Shan, who is a founder and chairman of the Sunda and Keda groups of companies with operations in Ghana in the last 20 years. Realizing the difficulties his son went through and the impact it had on his family, after being diagnosed with a hole in heart at age 5, he gladly accepted a call when businessman Herbert Mensah suggested to him the idea of lending a hand to help patients in need at the Cardiothoracic Center.
Playing some of my pound from my heart. You know, when my elder son was born in 2005, after he was born 4 or 5 months, we got from the doctor, he has the heart disease. That time, the period, we feel very painful. And we go to a very good hospital in China, and he do the operation. He gets saved. But after he gets saved, in the next 4 or 5 years, he always sick, you know, because the body is not so strong. I feel we need to do something. But actually, you know, in year 2005, that time I discussed with my wife. I say we need to help the people, the children who has the heart disease in the future when we are qualified. We are thinking about that time in 2005. But before we think to do that in China. But when Mr. Herbert told me the child here in Ghana need to help.
For 17-year-old Shen Yuan, it is an honor to be the face of the foundation, and it promises to promote activities of the National Cardiothoracic Center in China with the aim of attracting more financial support for the needy in desperate need of care at the facility.
I've learned that in Ghana, in many places, you know, many childs, their condition is that they cannot go to the hospital because of many issues and problems, such as the economic problems. So here I understand the pain and the hurt that people that suffer from heart disease is really really painful. So I really want to help the child to make them to get saved and be cured, to get in the hospital, to have a better life. And this is the condition. So I decided to establish this foundation. I think for every year I will support more than 25 children and up to like 25 to 30 children. And by the year after this year, there will be another 25 children and I will support them.
Chief Executive Officer of the Korle Bu Teaching Hospital, Opoku Ware Ampoma, says because of the cost of equipment, the recent depreciation of the cedi against the dollar had made it more difficult for parents to get the cedi equivalent to undergo surgery.
Many times we find that many people are not aware of what can be done locally or within our country, and I'm grateful that with this initiative, he's decided that he's going to invest in the local facility, which will then make sure that our doctors can get the necessary wherewithal to be able to treat our patients. And I believe that with this, he also gets more out of his investment.